Hey everybody, it's Tim Thompson with SPF Insurance. And today I want to just give you a brief update on what's happened in all of the health insurance marketplace here in California. Last year, the state of California imposed a mandate that all health insurance plans had to offer maternity and um, autism related coverage. So every carrier had to scramble to figure out how they were going to add those two particular benefits into all of their plans. Previously, there were just 27 plans that offered maternity coverage. Now, there's over 120, depending upon where you live in the state of California. So today what I want to do is just kind of give you here's who changed what and give you some tips on what to look for in terms of the carriers that'll have plans that will probably be the best fit for your particular situation. So starting from an alphabetical standpoint, the first one up is Aetna. Aetna basically had no maternity coverage at all. So what they did was they simply bolted maternity coverage and autism coverage onto all of their existing plans and raised the prices. What that effectively did was that Aetna is really not a strong player in the California market anymore. Their plans have really high deductibles and high out-of-pocket maximums, especially the out-of-pocket maximum. So because of the rates and the deductibles and max out-of-pockets they offer, they're really not competitive anymore. So the only place they'll really still be strong is for people that have existing conditions that the other carriers won't touch. Many times Aetna will be a little bit more lenient with those types of situations, but you'll need to check with us in order to figure out if you fall into that particular situation. So second up is Anthem Blue Cross. Now, over the last couple of years, Anthem Blue Cross has really been the go-to carrier because they had great plans at great prices, and they were lower prices than comparable plans from the other carriers. So we did a ton of Anthem Blue Cross. But with the maternity coverage being added into all their plans, what Anthem also did was they started dropping a number of their higher deductible plans that were also the lowest cost plans. So now what they're left with is sort of the middle and upper end of their portfolio. And they've gotten rid of the plans that were really competitive that a lot of people liked because it had just the benefits they wanted at a low enough price they could afford. So Anthem Blue Cross isn't completely out of the market, but they are not as competitive as they used to be. So don't forget about them. They still have some good HSA plans, and some of their the Smart Sense and the Clear Protection plans are still good plans and could fit what you specifically need. Next up is Blue Shield of California. Now, Blue Shield offered no maternity coverage previously, with the exception of one of their 5,000 PPOs and one HMO plan. When they bolted all of the maternity and other stuff into it, the autism care, they effectively decided that they needed to just throw everything out and start over. So that's what they did. They created a whole new portfolio of plans. Now, the drawback with these new plans is, yes, they're easy to understand, but they're priced in such a fashion, they're just not affordable given the benefits that each of the plans has. So they really hurt themselves from a competition standpoint. I don't see them getting a whole lot of new subscribers over the course of the year, other than by captive Blue Shield agents that are just promoting Blue Shield only. So you can kind of look at them, but they're really not going to be very much use to you in your selections. Next up is Cigna. Now, Cigna is one of the big changes. They offered no maternity coverage previously, and they've kind of been a plan and a carrier that really wasn't competitive for the last 5, 6, 8 years, whatever it is. But as a result of the July 1st stuff, they added in maternity and autism coverage, and they really didn't change their rates too much. So now they're actually very competitive, especially for younger people and people that are above 55. So 35 and below and 55 and above. Cigna plans from a cost and benefit standpoint can be very attractive. So pay attention to those. Next up is HealthNet. Now this is probably the biggest of the surprise because HealthNet's always sort of been that, wannabe in California, not really ever been really attractive other than in their HSA plans. They've always had the best health savings account compatible plans. That part hasn't changed. What has changed is that all of their PPO plans now are really competitive, but they're competitive sort of at the lower end of the marketplace. Okay, so they kind of took over where Anthem Blue Cross was, and they've got a portfolio of plans that are really, really targeting that side of the market. So if you're looking for low cost coverage that gives you the basic benefits you want and need in a plan, that's probably going to be your go-to location, HealthNet. The next one is Kaiser Permanente. Now, everybody either loves Kaiser or they hate Kaiser. It is the same company that it always was. They have the same plans that they offered previously because they've always had maternity coverage in their plans. Now, they've added maternity coverage to all of the plans instead of just a fair portion of them. Now, so Kaiser is great and wonderful. Pick it or choose it. If you really want, if you're already in Kaiser, then a Kaiser plan is probably what you're going to choose. If you're outside of Kaiser, you probably aren't going to be as interested in moving into a captive network where only Kaiser physicians are your choice. So, but that's your choice. And then the pre-existing condition insurance plan is the last one. And that's kind of a specialty case because that's for people who have existing conditions that would result in every insurance company declining them for coverage. So if that's your situation, the pre-existing condition insurance plan is a great fit. The rates haven't changed this year. It's always offered maternity and autism coverage. And it's actually a really strong benefit plan. So if you have questions on any of these things, please give us a call. We'd love to go over the details with you. Just remember, the companies to keep in mind right now are HealthNet, Cigna, and a little bit of the Anthem Blue Cross. The other carriers aren't bad, they just aren't as competitive from a benefits and cost standpoint. So for now, take care, and we'll look forward to talking to you soon.